Is there ever a case where antidepressants work?
Most of the efficacy studies or the studies to get the drug approved, it was barely better than placebo. Most of the other ones, because you only needed to get 2 studies that showed that the drug had efficacy and against the safety. And, of course, that was one of the things I learned, that the pharmaceutical companies control the studies to get the drugs approved on the market. I'm like, wait, you're letting them control it? They get to control the narrative. They get to control the protocols. Like, that makes no sense from a regulatory agency that you think is supposed to be doing the job of public health and determining. But so when I look back at the efficacy of the antidepressant products, it was barely better than placebo. And then to see how marketing took it and called it a chemical imbalance. And so there's this whole lie of the chemical imbalance.
It's a marketing ploy?
Yeah, it's marketing.
That's not science.
We know that it maybe could do something to a brain, but there is no test. Like, if you go into your doctor, how do they mostly tell you that you may be depressed? You fill out a questionnaire. Well, if you look at that questionnaire that they use, that was created. Nobody looks at the tiny type at the very bottom. It's called the PHQ-9 screening form. And it's systematically used across the US and I think even across the world. And it was created by a generous donation. If you look at the very bottom, a generous donation by Pfizer Inc. and 3 key opinion leaders.
It leads people into basically saying, yes, I'm
It's a
depressed.
screening tool. It is like, we use it in marketing. We call it a funnel.
It's like honey to flies.
Yes. Get a bunch of people here, because once they're in the funnel, they're ours.